Ladies and gentlemen, my name is Anthony Iotropoulos, and today we're going to talk to some parents about childhood vaccines. And what do? They protect us. They protect our kids. But, I mean, are they all really good for us? Do we really all need them? I don't know. We're going to ask people and find out. Okay, so hi. What's your name?
Hi, my name is Stephanie Johnson, and I have a 2-year-old daughter named Catherine.
I'm Anastasia.
And I'm Anthony. And you are the mother of?
Ivy, and she's 20 months old.
My name is Mary.
And you are the mother of?
3 kids.
What are vaccines and what do you know about them?
Well, I don't know too much about them. What I do know is that it was important to me to get my child vaccinated in order for her not to get sick around other kids.
Vaccines are meant to prevent children from having diseases.
Vaccines are shots that you give to kids and adults to ensure that they don't get diseases.
How important is child vaccination to you?
Pretty important.
And have all your children received their shots?
Yes.
It was very important actually, because I would not take her out in public if before she got her vaccinations.
Good. And has Ivy received all of her shots?
Yes, she has. She's up to date.
Very, very important, like life-altering important.
That's good. Has your child received all of her shots?
Yes, and if there were more, I would give her more.
Do you feel that vaccines are safe for children and infants?
Yes,
Why?
because scientists and doctors wouldn't tell you to get them if they weren't safe.
I think that makes sense too.
I wouldn't say infants,
Okay.
but I felt the need to get them done. But the risk gets lower once they're older,
Why do you feel like vaccines may not be safe for infants?
because their immune system is just so weak.
To a certain extent, they are, depending on the doctor who's giving them.
Why do you feel that they may not be?
Some are not capable of giving the right dosage, the right year. Some will overdose the infant or the child with too much vaccines at one time.
Are vaccines more dangerous for infants than the diseases that they prevent?
No, I do not think. Yes, they are.
Definitely not. Definitely not.
Some I feel are dangerous and they can harm an infant depending on how strong that infant is.
Do you believe that there is a link between vaccines and autism?
No.
I've read a lot about it, but I don't agree with it.
No, no. Nope.
Yeah, there's not. Where do you receive your information regarding vaccines?
Online and from our pediatrician.
And do you find that that's pretty trustworthy?
Yes, because it's not only one source.
From my doctor and my daughter's pediatrician.
My children's doctor.
Should children receive all vaccines and are they all really necessary? 30 years ago, vaccines protected young children from only 7 diseases. Today we can protect them from at least 14 dangerous diseases because of medical advances. The fact is, kids are offered more protection from dangerous diseases now than at any previous point in history. The decline in the incidence of most vaccine-preventable diseases from the pre-vaccine era to today ranges from 72 to 100%. And as the incidence of such diseases has declined, so has the annual death toll attributable to them. The measles, for example, caused an average of about 450 deaths per year in the United States between 1956 and 1960. The measles vaccine was introduced in 1963, and by 1998, only 100 cases with no deaths were reported nationwide. In April 2014, the CDC estimated that vaccines administered to children born in the past 20 years will present more than 700,000 deaths. As medical advancements continue, children and adults are able to be protected from some typical diseases to more serious ones, including protection from some forms of cancer, like those from human papillomavirus or HPV. A proven way to prevent cancer, who wouldn't want that? So even though most dangerous diseases have been wiped out, should parents still vaccinate their kids? Even with some diseases officially eradicated, the responsibility to vaccinate remains the same. Pathogens that cause other once common communicable diseases still exist, and being unvaccinated dramatically increases one's risk for infection. If you're unvaccinated for measles, for example, you experience a 22-fold greater chance of contracting the disease, with serious consequences remaining the same. Childhood vaccination remains as important now as it has ever been. Vaccines also protect communities, not just individuals. The greater the number of vaccinated individuals in a community, the greater the protection for the people in that community, whether they are vaccinated or not. In a community that has reached a threshold level of vaccination, a percentage that varies on a number of factors, that disease is unable to gain a foothold and spread, even if an occasional case occurs. This phenomenon is known as herd immunity. For herd immunity to be effective, vaccine rates may need to be as high as 95%, especially for highly infectious diseases like measles. There are some medically valid reasons for being unvaccinated, such as age or immunocompromised status, but people may not be fully vaccinated because of cost, access, misinformation, or personal choice. The principle of herd immunity shows that the more people there are who choose not to be vaccinated or fail to be fully vaccinated, the less likely it is that the shield of herd immunity can protect those who are medically unable to be vaccinated. Remember, diseases can spread even without displaying any symptoms. Being fully up to date on your shots can best protect you and everyone else around you. Even though vaccines are generally safe and prevent major diseases, isn't there a link between vaccines or their ingredients and autism? Absolutely not. The supposed link between vaccinations and autism can be traced back to a 1998 paper published in the British journal The Lancet. The now retracted study was conducted on a sample of only 12 children and has been accused of containing falsified data. Scientists and physicians examined countless journals, publications, and research documents to deduce with certainty if any link between vaccines and autism existed. With the original conclusion thoroughly debunked and a better understanding of the disorder, experts agree that autism begins during fetal development as a result of both genetic and environmental influences, not due to vaccination. This misinformation continues to exist, probably due to the speed at which it can be accessed thanks to the internet. The bottom line is, vaccinating you and your child is the best choice to protect his or her overall health, as well as protecting the health of those around you. Your primary care provider can provide you with the most up-to-date information on lifestyle choices and when and where to receive the most recent vaccines. Being on top of your shots is important, so we may all depend on herd immunity for additional protection from disease. Remember, some people can't get vaccines due to a compromised immune system and rely on the public to keep up to date on their shots. You could spread a disease and infect a bystander without even knowing it. Always check your sources and make sure that thorough research can back up any claims. It's pretty easy to believe false information on the internet. If it's not from government publications, scientific, or other medical journals, I'd be wary of any claims that vaccines cause more harm than good. So remember, vaccinate your kids. Do you have any additional comments or concerns that you'd like to tell the audience?
As a parent, I feel like we don't have an option to give our children vaccines or not. It is mandatory in a way of if we do not get our children vaccinated, they're not allowed in public schools. So at the end of the day, we as parents, it doesn't seem like we have an option on whether we want to give them vaccines or not.
Vaccinations are very important.
Do you have any additional concerns that you want to tell the audience?
Get your kids vaccinated, otherwise they're going to die from unnecessary diseases.
And we're out.